The deadline to sign up for health insurance under the Affordable Care Act is Saturday. As of today, the number of people signing up is lower than the same time last year. According to the Centers for Medicare and Medicaid Services, nearly 20% fewer new people have signed up for plans compared to 2017. Overall, enrollment is down 12% in 2018. Mary Agnes Carey, senior correspondent at Kaiser Health News, is in Washington and joins me now. Mary Agnes, welcome. So there's been a surge in signups over the past week, but why do you think we're seeing this overall drop?
There's been big drops in federal funding for outreach and on-the-ground assistance to help people sign up for coverage. Some people also are aware of the fact that there's no longer a financial penalty if you don't enroll in health insurance. It's known as the individual mandate. That may be keeping some people away. There's also some thoughts that with the economy improving, some people may be getting coverage at their jobs, their new jobs, so maybe that is part of it. You may have people already enrolled who have just decided they're not coming back to the exchanges to look for a new plan. I wouldn't advise that. I think you should. But we also have to think about these new short-term plans. They're not as generous, as comprehensive. They're also not as expensive as the Affordable Care Act plans, and they're not offered on those exchanges. So that may be drawing some people out of the marketplaces.
Okay, so Mary Agnes, if the numbers don't change significantly over the next couple of days, what does that mean for the nation's uninsured rate? I mean, is there any way to put together all the different possibilities that you were just talking about and figure out how many people then will still be uninsured?
Sure. You have a fairly significant number of people who are uninsured right now. I think the number is around 20. It's about 15 million people who are uninsured. And what's interesting about this is about a quarter of those folks could qualify for a subsidy on the Affordable Care Act. So if people don't go to healthcare.gov or they don't try to go to an assister or a navigator or an agent or call the 800 number, they could be missing out on premium assistance that's part of the law that could help them get coverage.
So you're talking about millions of people who are missing out on potential coverage.
Exactly. About a quarter of that number of the current uninsured could qualify for a subsidy, according to a new study from my health policy colleagues at the Kaiser Family Foundation. So it's really important if you're not covered to think about this.
All right, Mary Agnes, according to a CBS News exit poll data from last month, voters in this year's midterms believed health care was the most important issue facing the country. So how do you explain then the disparity in enrollment with that, issue being so important?
I think people have incredibly busy lives, and healthcare is incredibly complicated. People may think I'm going to get to looking at the ACA, I'm going to think about enrollment, but here we are right up against the deadline, which is what's happened for all of the years that the Affordable Care Act has been in place. We've had the exchanges open since 2014, and there is always a surge at the end. We also have to remember that the numbers we're talking about here and the drop in enrollment refers to the 39 states that are on the healthcare.gov exchanges. About 11 states also have exchanges, including California, that has about 1.4 million enrollees. So you might see a real bump in those numbers by the time the deadline comes and goes.
So those 37 states that you just mentioned, because according to the Kaiser Family Foundation, 37 states, including Washington, D.C., have voted for Medicaid expansion. Are those the same 37 you were just referring to?
No, that's slightly different. There are states that have voted for the Medicaid expansion, as you note. What I'm talking about are 39 states that let the federal government, healthcare.gov, run their health insurance exchanges. So they're different. There are different elements there.
Okay, well, let's talk about those 37 then that have voted for Medicaid expansion. What does that signify to you?
I think it signifies a lot of things. Governors are not really willing to leave money on the table. The Affordable Care Act allows for the new enrollees in Medicaid, if you expand, you being a state under the Affordable Care Act, they'll pick up, the federal government being pick up to 90% of the cost for the new enrollees. And if you get sick in most states, in most hospitals, take Medicare, there's a federal law that requires them to treat you no matter whether you have insurance or not. When those uninsured folks come into the hospital doors, the taxpayers pay for it. So a lot of governors, even in red states, are looking at that Medicaid expansion. They want their folks to have coverage, and they've decided to go to Medicaid. And some of that political fire around the Affordable Care Act and Medicaid expansion, while it is definitely still there in the really red states, in a lot of states, even Republican governors have said, this is a deal I don't want to walk away from.
Well, I mean, costs are so high, it's almost impossible for anyone to get by without some kind of coverage. Yet, Mary Agnes, earlier this week, former President Obama released a video urging people to sign up. Let's play part of that.
Well, it is that time of year again. The time my team tries to get me to reference some viral trend or otherwise make a fool out of myself in the name of encouraging more young people to sign up for health insurance. But not this year. You know why? Because this year is different.
So, Mary Agnes, why is this year different? How has his tactics changed?
Well, I think he was making, if I remember the whole tape correctly, he was making a joke about he's not going to do anything funny, no funny stuff to get you enroll health insurance. But at the end of that video, they put in a filter with sunglasses and a funny sky behind him. So I think that what he's trying to get to is he understands that there's been a lot of political battles around the Affordable Care Act. There hasn't been a lot of attention to it. Let's face it, at the beginning of open enrollment, we had the midterms. We're at the end of open enrollment, we're talking about a potential government shutdown. All sorts of headlines, all sorts of distractions, rather. And I think he's just trying to get people to go back and to focus on the Affordable Care Act. It was his signature domestic policy achievement. One of its nicknames is Obamacare. He owns it, he supports it, and he's just trying to get folks to enroll. And that video is really kind of geared at the younger set, and the younger people who have come in, they tend to be healthier, and they'll balance out the expenses of the older and sicker people that are in the exchanges.
All right, worth repeating, the deadline is this Saturday to sign up. Mary Agnes Carey, thank you so much for your time.
Thanks for having me.